सर प्लीज शुरू करा.
Okay. Good afternoon, everyone. Today we are going to discuss about iontophoresis. This is especially for second BPTH in electrotherapy subject. Myself, Dr. Abhijit Satralkar, Associate Professor of PS Modern College of Physiotherapy. So today what we are going to learn is, we are going to see in brief about what is iontophoresis, its histological background, principle of iontophoresis, mechanism, treatment principles, effects of iontophoresis, application, common drug used and indication, treatment parameters, adverse effects and complications, and its contraindications. Okay, so what do you mean by iontophoresis? Now, iontophoresis is a non-invasive process that uses locally applied continuous direct current to passively diffuse ionized medication into the skin. Now over here, what do you mean by non-invasive is it does not involve any cutting of the skin. It does not involve going inside the patient's body and doing the process. Direct current, as we all know, it is a unidirectional current and it flows in one direction. And the passive diffusion of ion means it uses the external force. Over here, the external force is our direct current to passively diffuse the ion inside the skin membrane. Okay, so in short, iontophoresis is nothing but ionto means ions and phoresis means transfer. Over here, you should be aware about the cations are the positive ions while the anions are the negative ions. Now let's see what about the histological background. The scientists conducted two experiments in 1980. Okay, first experiment conducted on potato. What he did is he connected two electrodes on each side of the potato. He made one hole and just what he did is he put the potassium iodide solution into that particular potato. Now, once the potential difference and electricity was passed across this electrode, what happened is iodine moved towards the positive electrode. Since the iodine had a negative charge, it moved towards the positive electrode. It combined with the starch in the potato and the bluish discoloration was seen on the surface of the potato. After this, he did the experiment on a rabbit in which he took two rabbits, he put them in a series of the electric current, and A rabbit received a strychnine sulfate solution while the B rabbit received a potassium cyanide solution. Now we'll see the detail about this experiment. Now the first circumstance in which the A rabbit was kept at negative polarity while the B rabbit was kept at the positive polarity. Now, since strychnine sulfate, in which strychnine has a positive ion and sulfate act as a negative ion, what happened when the negative potential was applied across the A, the sulfate went and get attached to the, sulfate got repelled from this electrode and went inside the rabbit. While the strychnine consisting of a positive charge, it got attracted towards this negative electrode. While in B rabbit, what happened was potassium, which had a positive ion, right, it got repelled from this positive electrode inside the rabbit, while the cyanide, which had negative ions, it got attracted towards this positive electrode. Now what happened, this cyanide and strychnine, these are the poisonous ions, so it didn't went inside the rabbit. So what happened, both the rabbit survived. Now what he did is he altered the potential difference. Now he applied positive charge across the A and negative charge across the B. Now what happened over here, the strychnine which was applied over this electrode went inside the rabbit by the repulsion property, while the cyanide which was applied to rabbit B got repelled from this negative electrode and went inside the rabbit. So the result of this experiment was that both rabbits died. Clear? Now what is the principle of iontophoresis? It works on the ionic polarity. Like charges repel each other and opposite charges attract each other. Now for suppose this is the skin, okay, and we applied the two electrodes with solutions, right, which contains the ions. What will happen? The negative ions will get attracted towards the anode while the positive ions will get attracted towards the cathode. This I will explain in next slide over here. Now if we see in our day-to-day electrotherapy, what we do is we denote the anode with a red color, which is a positive electrode, while cathode with a black electrode, which is a negative electrode, right? Now, these positively charged are the cations, while the negatively charged are the anions, okay? So what will happen whenever the potential difference is applied across the two electrodes? Once the anode is positive, the anions are going to get attracted towards the anode, while the cations are going to get attracted towards the cathode. So again, like charges repel each other and opposite charges attract each other. If we see the skin permeability, right? If we see this diagram over here, the drug is applied, right? So the positive ions are getting repelled inside the tissue or the skin, and it gets inside and goes into the bloodstream, and the drug flows across the bloodstream, due to which we are going to get the effect. Right. For example, if we see the next diagram, I want to treat one patient with a negative drug ion, right? I will place the drug below the negative electrode, which will cause repulsion of the drug ion, negative drug ion inside the body tissue. Okay. So the electrode placement depends upon the electric charge of the ion which you are trying to deliver into the tissue. A positive ion will be delivered from a positive electrode, and the negative ion will be delivered by a negative electrode. Now, if we compare with the phonophorosis, right, you are aware that phonophorosis is again use of a drug using ultrasound. Now, iontophoresis over here uses a direct current for the penetration of ion, while the phonophorosis uses ultrasound for penetration of molecules inside the skin. If we compare it with the injection, now iontophoresis treatment is non-invasive, so risk of infection is reduced. Iontophoresis treatment provides pain-free option for the patients who are reluctant to receive injections. And iontophoresis treatment minimizes tissue trauma that occurs with increased pressure from an injection. If we compare it with the oral medication, iontophoresis treatment delivers drug without them being absorbed by the gastrointestinal tract. Iontophoresis treatment bypasses initial hepatic filtration metabolism. Iontophoresis treatment has greatly reduced risk of overdosage. Coming next, what are the iontophoresis principles for the treatment? Over here, we are going to look for current applied, type of stimulators or the source being used, electrode size, ionic polarity, drug concentration, pH of drug, and preservatives. Now, coming to the current applied, over here, for the movement of ion into the tissue, a direct current or the galvanic is applied. Sometimes monophasic pulse currents can also be used for application, but it is very rare. As current intensity increases, the flow of ion increases. Treatment is usually applied with 5 milliamperes of current, up to 5% of low ionic concentration, and for the average duration of 10 to 20 minutes. Now, some studies have proved that low amplitude is more helpful for the patients. Type of stimulators and source. Over here, we are using constant stimulator is preferred over a constant voltage stimulator, so that the magnitude of the current remains at the same level in terms of skin resistance. Okay. Now, electrode size. Negative electrode should be larger in size, as much as twice of a positive electrode. Now, why negative electrode? Because it is seen that the alkaline reactions, which we are going to see in further slides, is more common under the negative electrode. So the negative electrode should be larger in size. This causes reduced current density and irritation below the electrode. Ionic polarity solely works on the principle of like poles repel and unlike poles attract. So preferred ions are placed under the same polarity, so it gets repelled into the skin. Same is termed as an active electrode. So remember over here, whichever the drug we are using, we are placing it under one particular electrode, and that electrode will be considered as an active electrode. The other electrode used to complete the circuit is either called as indifferent electrode, dispersive electrode, yeah, inactive electrode. Drug concentration, the ion has been shown to increase with higher concentration of solute to the donor electrode. Okay, so the more the ions which are available under that particular electrode, more will be the penetration of that particular ions. pH of the drug. pH is essential for the iontophoretic delivery of drugs and patient comfort. The optimum solution are those that exist predominantly in an ionized form. Fine. Last one is preservatives. Preservatives in the formulation can be transferred into the skin during iontophoresis. This may cause skin erythema, that is localized red spot. Excuse me, can I ask everyone to go on mute, please? There is some disturbances coming on. Yeah. Preservatives, again, the preservatives is the formulation can be used to transfer into the skin during iontophoresis. Preservatives create a competition that results in reduction of drug ion through the skin by the applied current. Now, coming to the effects of antiforces, we are going to get over here mainly 4 effects: hyperemia, dissociation, pH reactions, and ion penetration. Now, we'll look after one by one. Ionic penetration. Penetration of the ions is up to 1 centimeters inside the skin. After this, transmission occurs through capillary circulation. More blood circulation across the affected segments, more will be the penetration. The rate of drug penetration increases with increasing charge of the drug ion, increasing electric current, increasing molecular weight of the ion. Okay, smaller, lighter ions are more mobile. Fine. Now, acidic and alkaline reactions, right? Acidic reaction occurs under positive electrode. Okay, negatively charged chloride ions from the sodium chloride in tissue gets attracted towards the anode. It is considered as a sclerotic, which is responsible for hardening of tissue, which indirectly serves as analgesic agent due to local release of oxygen. Alkaline reaction occurs under negative electrode, that is cathode, caused due to movement of sodium ions from the sodium chloride towards the negative electrode. Sodium, which are positive ions, reacts with the water to form sodium hydroxide. This is also again considered as a sclerotic, which is softening agent due to hydrogen release serving in the management of scar and burns. Next is hyperemia. Both electrodes produce hyperemia and heat due to resulting vasodilation and chemical reaction. Cathodal hyperemia is more pronounced and takes more time to disappear, but both electrode time is not more than 1 hour. Dissociation. Ionizing substances dissociates in solution, releasing ions, converting them into electrolyte. Ions get absorbed through capillary circulation and binds with free radical and act on the targeted affected areas. Now, application, we are going to follow these steps: the preparation of patient, preparation of apparatus, procedure, winding up and reassessing of the patient, and follow. In preparation of patient, we know that we do the assessment of indications, contraindications. We will do majorly the assessment of skin sensitivity, right? Then coming to decreasing the tissue resistance. Okay, all these things are going to take place in patient preparation. While the preparation of apparatus includes checking of the electrode, testing of the apparatus, and preparation of the electrolyte solution. After this, what we are going to do is we are going to localize the targeted area on the patient's body. Then we are going to apply that particular ionic drug under one particular electrode. If the desired drug is a negative ion, we will put the negative ions under the negative electrode, and that negative electrode will be placed directly upon the site of the lesion. Okay, and indirect different electrode is placed. What do is to reassess the patient. Now, this is very important because sometimes the patient might get reacted to some ions, sometimes in skin. Okay, so this is very necessary while we complete our treatment. And after this, follow-up is taking place, and we are going to check for the same preparation part and again the preparation of apparatus in the follow-up sessions. Next, coming to the common indications and drugs used over here, you can see, right, for the inflammation with pain, we can use dexamethasone sodium phosphate with 0.4% of concentration and which is placed under the negative electrode. Similarly, diclofenac with 5% under negative, ketoprofen 10% under the negative, lidocaine hydrochloride 4% under the positive, dexamethasone 0.4% under the negative, hydrocortisone 4% under the negative, salicylate 0.5% under the negative. For the drug used as sodium methacholine potassium citrate with 2%, 0.3% and 2% concentration respectively. And sodium salicylate is placed under negative, methacholine is under the positive, sodium citrate is under the negative electrode. For muscle spasm, we use magnesium sulfate, baclofen, and calcium chloride with 2%, 0.5%, and 2% of concentration, which is placed under positive, negative, and positive electrodes respectively. Next indication is scar. Over here, we are going to use potassium iodide, sodium chloride, and salicylate with 10%, 3%, and 0.5% of concentration. All the drugs are placed under negative electrode. Calcium deposit, we can use acetic acid, 4% under the negative electrode. Hyperhidrosis. Now, hyperhidrosis is the most common indication which has been treated successfully using the iontophoresis. Over here, we can use tap water, glycopyrronium bromide solution with the 5% of concentration, and both this can be placed under positive electrode. Neuropathy, gabapentin 6% under the negative, edema, hyaluronidase, salicylate, McCoy 4%, 0.5%, and 3% under positive, negative, and positive electrodes. Plantar warts, sodium salicylate can be used, 2% of concentration under the negative electrode. For gout, lithium citrate with 3% of concentration under the positive electrode. And for skin lesion, zinc citrate with 2% of concentration under the positive electrode. Now, what should be the parameters set over the treatment? The current density is the first parameter. It should be 0.5 milliampere per centimeter square for negative electrode and 1 milliampere per centimeter square for positive electrode. Current intensity, right? The recommended intensity is 3 milliamperes to 5 milliamperes and should not exceed above 12 milliamperes. Okay. Treatment duration, the recommended range is 10 to 20% for the treatment. Skin inspection should be done every 5 to 6 minutes just to take care whether any reactions are happening under the electrode or not. Now the last is formula to calculate the substance grams. Now the substance gram is nothing but the concentration of ions what we are going to use for the treatment. It can be calculated as I into T into ECE, where I stands for intensity in amperes, T for time, ECE is nothing but electrochemical equivalent, which represents standard figures for ionic transfer with known current and time factor. Now these are the standardized values which we can obtain, right? Which are used for the iontophoresis. Now traditional electrode what we use in our departments regularly can be used like metal, tin, copper, lead, aluminium electrodes, which are covered with sponge, towel, or gauze with skin contact. Okay. Now another types of electrode are the commercial electrodes. Over here, we can see these are the different commercial electrodes which can be used over here. If we see this diagram, we can see the drug can get injected inside the cavity of an electrode. Now this is the diagram for that electrode. Right? This is the area from where we can inject the drug, and drug gets accumulated inside this cavity. And electrodes can be applied with particular potentials. These are the electrodes which can be used for face. These are the different electrodes where one area can be having a positive electrode and another negative electrode with cavity for the drugs. This is antophorosis generator. Coming to adverse effects and complications, alkaline reactions and chemical burns are the most common complications. Chemical burns can develop under either electrode. Alkaline reactions are more common. This is result of accumulation of sodium hydroxide under the cathode. Direct electrical current through the skin creates movement of ions. The movement of ions leads to an alteration in normal skin pH. Okay, the skin burns are usually caused by direct current, not the medication usually. Skin becomes pinkish initially, followed by grayish oozing wound later, and should be treated with antibiotic and sterile dressings. Next is heat burns. It occurs due to excessive heat formation in high resistance area. Now occurs due to electrodes which are not moist, not fitting well, and lose contact with the skin. What can we do to reduce heat burns? Thoroughly cleanse the skin with soap, water, and alcohol swab prior to the treatment. Saturate electrodes thoroughly so there are no dry areas. Do not underfill or overfill the electrodes. Administer iontophoresis treatment to undamaged skin only. Reduce current density by decreasing the electrode size and or decreasing the current. Now, next is allergic reactions to iron. If the patient is allergic to seafood, substances like iodine should not be used. This might cause reactions if the patient is allergic. Patient with acute peptic ulcer or gastritis reacts poorly to the hydrocortisone. Patient with aspirin problems react poorly to salicylate. Patient sensitive to metals can react to copper, zinc, magnesium electrodes. Now, what all precautions we can take for this treatment is testing should be done properly. Okay, electrode placement and attachment should be observed properly. Right, if the electrodes are loosely fitting, if there is no proper contact with the skin, right, whether the proper what we said, the polarity of the electrode is proper or not, that should be properly checked. We should do not use the opposite polarity ions in same treatment. This might cause a competition within the ions itself, and it might cross react under the skin. Do not use two chemicals under one electrode. Again, the same. It might cause competition within the ions. That means if the ions are getting more saturated below the electrode, that might cause irritation to the skins and can damage the skin. Contraindications: cardiac pacemakers, chest area stimulation, implanted stimulators, over the carotid region in the neck, acute swelling, bleeding, decrease or absence of sensation, allergic to medicine, cancer, uncontrolled hypertension, peripheral vascular diseases, thrombophlebitis, pregnancy, severe osteoporosis, extreme obesity, and seizure disorders. Now, we will just summarize what all things we had studied in today's lecture. We had seen what do we mean by ion transfer, Ludak experiment of potato and the rabbit. Mechanism, how ion transfer takes place. Treatment principles we had seen, current applied, type of stimulation, electrode size, ionic polarity, drug concentration, pH of drug, preservatives, effect of iontophoresis, hyperemia, ion penetration, pH reactions, dissociation. Now application, right? Common drugs used and indications, treatment parameters, current density, current intensity, treatment duration, formula to calculate substance gram. What are the adverse effects and complications, precautions, and contraindications? So these are the few references from where you can read about the iontophoresis. Thank you. If you are having any doubts, you can over here.